And the next partnership we'll hear from is the HealthTech Hub Africa.
Africa represents 22% of the global disease burden, yet only 3% of the world's health workforce. Technology and innovation holds promise for addressing some of the most urgent health challenges across the African continent. Africa is home to exceptional entrepreneurs, many of whom are developing health tech solutions with great potential for impact. Yet many face barriers in securing funding and working with governments to scale the solutions in public health systems. The HealthTech Hub Africa was founded to help governments and startups collaborate on data and technology-enabled innovations that strengthen African health systems. The hub is unique in its dual mission, focused on meeting the needs of both entrepreneurs and governments as they collectively work to advance health equity.
Welcome to the HealthTech Hub Africa. The HealthTech Hub Africa is more than just an accelerator, and it's more than just a physical space in Kigali, Rwanda.
Since 2022, the HealthTech Hub Africa has supported 68 organizations across 17 African countries, working on critical issues from cardiovascular disease to breast cancer to data and digital systems to strengthen healthcare delivery.
Since I joined the HealthTech program, we have been exposed to marketplace. We got a partnership with another international organization, and also we were mentored. In that period, it helped us to build our business, which increase our users and also increase our revenues.
We are able to access mentorship, quality mentorship, to be market ready as we were just starting. And we were also able to learn about the challenges and the trends in the African healthcare industry.
It allows us to connect directly with innovators from Rwanda, but also from across the continent. It's very important for us to be able to have direct view on the biggest barriers, the biggest challenges that they are facing, what are the experiences, hear from them in terms of why they would hope government Rwanda in particular to be a bit more less. And so we take that information and use that to then advise the government on what they need to do in terms of addressing those policy barriers.
For true impact, technologists and governments must work hand in hand in meaningful partnership. We know that those who sit closest to the health challenges are best positioned to help address them, which underscores the importance of supporting local entrepreneurs who are creating local solutions for local challenges. Yet we also know that without scale and support, these entrepreneurs and their solutions will not have the impact on health systems and people we know they can. Governments have a critical role to play in accelerating both development and adoption of new technologies that can revolutionize healthcare delivery. The HealthTech Hub Africa is unique in dually addressing both the needs of governments and of entrepreneurs. And our work is just beginning. This partnership is growing rapidly, with African organizations and institutions around the world coming together to support entrepreneurs and government partners in scaling innovations with the potential to improve health and well-being for millions across the African continent.
Representing this partnership, we have Rebecca Distler.
Hi, Rebecca. Health tech is kind of an interesting field, but also challenging because when it comes to adoption of any healthcare solution, any government would look at validations done at multiple levels, and usually early stage entrepreneurs are competing with global giants. So, how does the hub kind of help the entrepreneurs address this challenge besides the mentorship and the financial support that you provide them?
Absolutely. Thank you so much for that question. And before I answer, I just want to say I'm here from the Patrick J. McGovern Foundation, but it's a real privilege to represent a coalition of partners around the HealthTech Hub, begun by the leadership of the Novartis Foundation, Norskin Foundation, with Global Fund for HIV, TB, and AIDS coming on board as a critical partner, and of course our implementing partners, Bridge for Billions and the Center for Fourth Industrial Revolution. The question that you ask is precisely the vision and the mission of the HealthTech Hub. I'll speak, one of the things before even joining this foundation, I was a health tech entrepreneur, and I faced many of those challenges myself. These challenges of building technology, sometimes really good technology, but recognizing that good technology wasn't going to be enough to scale. And in fact, as you shared, financing isn't always enough to scale. There is all of these other enablers that goes into ensuring that health tech solutions are fit for purpose and can scale, particularly across the African continent. And so the HealthTech Hub is very much the platform that I wish I had when I was an entrepreneur. And it's a rapidly growing partnership. As shared in the video and in our application, it's really about this dual mission. There's the work that we do with the entrepreneurs that is focused on investment readiness, but it's also focused on some of those skills around product marketing and setting up legal entities and some of these challenges and barriers to actually building those kind of locally led solutions. And then that second kind of core bucket of work of the hub is really around engaging with governments in the policy blueprint. I think something that's been really, really impactful is to see how, as you said, governments are really interested in local innovation. They want to support local entrepreneurs in their countries and their communities. And frankly, those entrepreneurs are oftentimes the ones from the communities that are most impacted by the health disease burdens that they seek to address. And so there's a real appetite to engage those entrepreneurs, and we see that from the government partners. And what the hub does is to say, let's bring together not just Ministry of Health, by the way, but Ministry of ICT and other organizations and institutions that are so critical to the scale of these solutions, and let's bring them in dialogue with these entrepreneurs. Some of them are from for-profits that, as you said, may be in competition with some of these other organizations. Some of them are social enterprises and nonprofits. There's lots of different models that we're kind of presenting with the hub there. And I think that's what makes it quite unique in this space. It's not just an accelerator, and it's not just a matchmaking program, and it's not just about fundraising. It's really about taking an ecosystem approach to ensure that innovations, as shared, are fit for purpose and can scale in the public health systems where we know they can have the most impact.
A lot of the entrepreneurs that DRK Foundation has invested in have often struggled with this question, especially in the health space of government partnerships and finding those kind of sandboxes where there's a degree of openness to piloting solutions. So it's really exciting to see what you all are building here. I'm sort of curious, though, coming from the investor perspective, the application touched on the importance of the sustainability of this partnership by building the ecosystem over time and ensuring that it's not just kind of the governments and the entrepreneurs who are there with some intermediaries, but also ensuring that that kind of plethora of other resources out there, whether it's other investors, other support mechanisms, community roundtables or whatever, are present as well. How are you thinking about building that in the future?
Absolutely. It's the future is now. That's I'll say just last week there was both a health tech hub meetup in Nairobi that was bringing together some of those entrepreneurs. There was also a intergovernmental summit in Senegal that was bringing together some of those government partners. And I should share not just Ministry of Health in Senegal, but also Ministry of Health officials from Nigeria and from Kenya, I believe, were also there. I think in terms of the ecosystem, I come back to sort of this question of how do you both build the ecosystem and then try to drive that impact, right, or demonstrate that impact. If I can, I come back to the stories of the entrepreneurs themselves, because I think that it both speaks to the incredible work they're leading, but also to this really challenging question of how do you demonstrate impact and validate these solutions. One that I've always been impressed with, so LifeSten was one of the original fast-tracked, if you will, kind of projects in the hub.
through this partnership with the Ministry of Health in Rwanda, they actually emailed us today saying, we thought it was 17,000 people. They've reached 50,000 people and are doing some of the first remote screening for cardiovascular disease. GICMED, which is in Cameroon, is decreasing, they do digital pathology for breast cancer and are working to decrease the time from diagnosis from approximately 3 months to 24 hours, which is a huge leap in care. And then I think of organizations like Yena Health, which is in Ethiopia. They are the first pregnancy and period tracker in the country. And through that work, are also partnering with the Ministry of Health in Ethiopia, with the ministry in Ethiopia on innovation policy. And so what we see here is an opportunity, as you shared, to demonstrate where and how we can validate these solutions. That's not just let's fund another pilot, but to do it in concert with this ecosystem, to be able to use that platform to say, to bring other governments together to say, as we can learn from our partners who are fast tracking these solutions, how might we replicate that in our country and in our community? And then to help those entrepreneurs really document and validate those results and use that as the basis for future scale up and partnership.
Jumping in, I do have to ask this just because I see from your bio you are an AI expert and sort of the hot topic of the moment. So how do you see AI factoring into this program, if at all?
Very much so. We actually just ran the first AI for Health challenge through the hub, which we have not announced yet, but I'm hoping soon. So stay tuned on the winner of that challenge. Something that I think is fascinating is right now, so a number of the entrepreneurs are leveraging AI and data. And some of these questions that you actually see in the video itself, you saw that some of the questions that were coming out of the Intergovernmental Blueprint Group, one of them was around data sharing. And I think something that's really interesting about AI is we're spending a lot of time thinking about the technology and the opportunity, and these entrepreneurs are at the front lines. They are thinking about the applications of AI in their communities for their health challenges, and are very much the ones that you want in the driver's seat in thinking about how we co-create it. But they are also the ones that are engaging with governments around questions of data sharing, which is a really critical enabler of building fit-for-purpose AI, and AI that's representative and inclusive of the populations and communities that you're trying to serve. And I think it speaks to this dual model where we recognize that if we want to advance AI for health, yes, it's important to invest in some of those innovative tools, but we also have to invest in the enabling environment. These questions around data sharing and data privacy, data ownership, these are all important considerations that our entrepreneurs are facing head on, and the hub provides a platform for them to share learnings, to learn from their peers, certainly to be at the forefront of innovations. I think something that's been really fun is seeing how different folks that are working on AI-enabled tools want to come to the hub and share some of those innovations with those entrepreneurs, but that are also then really translating into breaking down some of those critical barriers that we know need to be broken down if we want AI to scale, because that's where we're going to see true impact. I think that's time.
And to complement the questions, thank you very much and congratulations. So it's a very broad-reaching sort of purpose, right? So which of the sectors in the health tech sector are the ones that have had the most success, which perhaps have had less because of different context issues? And is this a model that you think could be replicated in other continents as well? Yes. Or is it particular to the context?
Absolutely. So on that very last one, I'll name, not to sort of jump the gun on some work, but I know that many of the partners are talking about where and how we can replicate this model, right? Because this is, again, that model is very much around building the support for entrepreneurs, which is often where those accelerator programs drop off, while bringing together government partners. So that model itself very much has cross-regional applicability. A lot of good conversation around the partners around where and how we can share that model with others. I answered your first question. I answered your second one. Remind me very briefly of your first one.
The sectors within health tech that are the most successful.
Yes. So success is a really interesting word, right? Because I think some of this is so new. And I think one of the barriers to success has been scale, right? We know that particularly with digital health solutions, we need to get to scale and we need to operate efficiently at scale in order to see impact within the systems. Within the hub itself, there's 4 tracks. There's work on cardiovascular disease, on breast cancer, on data for decision making, and then data optimization. And I think each of these are seeing different levels of success. We're seeing a lot of really great work around virtual care and health. So seeing a lot of really interesting work around electronic health records, around data and digital platforms. Something that I think is interesting here is where we see a lot of successes, not just digitizing analog processes, but actually creating entirely new processes. And I think that's where we're seeing a lot of success. There's also some really exciting work around some of the actual hardware and the wearables themselves. I think diagnostics has been an area where we're learning a ton. But these are a couple where we're seeing, and I think the focus areas of the hubs also represent where we see a lot of potential and opportunity. So thank you. And thank you all for the questions.